Hi, I'm Dr. Ricardo Rodriguez, and today I want to talk to you about the different types of facelifts. This is a picture I got, when I was starting out of practice. I didn't have that many cases, and there are companies that specialize in giving you, pictures of patients to just sort of show patients what can be done. And this is, a typical facelift. But what I want you to notice is, the woman has her jowls in here, and she has been stretched down, but she's very stretched down below. Now, they obviously consider that a desirable result, but I can tell you that, in my mind, somebody that's stretched looks, well, done. And you have seen many of those people around. Now, why does that happen? And nobody starts out trying to make a patient stretched. What happens is the patient comes to your office and she says, quite reasonably, "Doc, I want to look younger, and I'm looking in the mirror and I don't like this. Or could you please do this?" And they do that and it looks fine. But one thing I want you to notice, first thing is when you do this, look, the corners of your mouth can get stretched, okay? And that is something that I typically see with what they call the lower facelift, is that the lower part of the face, since it's what gets stretched, this gets stretched. Now, let me give you a different viewpoint, okay? This picture is of a famous, silent film era actress. And they posted this picture on a computer screen. And behind the computer screen, there was a little camera. And the camera tracked the eye movements of the person looking at the picture. Therefore, what you're seeing here is the eye movements going like this, boom, boom, boom. And then, they go down to the nose a little bit and down to the mouth. And then really, down in here, the area that the patient is most concerned about, the jawline and the jowls, just a once over. Okay, and that is a profound difference in perception, because what you perceive in yourself to be what's aging is different from what other people perceive. The reason for this is that when other people look at you, they look at you in the eyes. Okay, I'm looking at you right now in the camera to your eyes, and you're looking at my eyes too. You don't care what my neck looks like or whether I got this little line in here. You're just sort of following what I say, and if I were closer to you to be even stronger, you try to hold my gaze to see, catch my meaning or catch my drift. Now, what if you focus your facelift on how other people perceive you, or how other people actually see you? Well, that is a different way of looking at facelifts, and it's a way I look at a facelift. Because when I want to make a person look younger, I want him to look younger to other people. I don't want him to look done. I want them to look younger. Okay, so here's another patient on whom I just did a brow lift, so rejuvenating the area around the eyes, and the mid-face. The mid-face was rejuvenated with a little bit of injection of fat and a mid-face lift, okay? Now, look at the difference in this patient, okay? She's not pulled, okay? The corners of her mouth aren't pulled. She just looks younger. You can't really tell. She just looks much better. Her face looks much sadder. She looks much more relaxed. And there's a sense of volume in here underneath the eyes that's very important. Now, as you look at her in all four projections, you will see that there is this line in here, which Dr. Bill Little from DC described as the OG line. And it's a nice curve in here indicating volume on the cheek. And that's why I like the 3/4 shot when I do post-op shots of my patients. But in here she's very flat, and that corresponds to a widening out of the face. As the tissues fall down, the face tends to get more square. And as you're looking at me right now, you're probably seeing, oh, there goes Dr. Rodriguez, his face is getting wide here. Well, maybe someday I'll get a facelift, but for now, look at her. She's getting the volume up in here. She looks much younger. The results are really outstanding. Now, do you have to wait a long time to do that? No, look at this woman. I mean, she was relatively young. She was in her early 40s. Does she look like she needed a facelift? No. But she obviously benefited from this. And again, okay, notice. Okay, just the eyes look more relaxed, the volume on the cheeks, the OG curve. She just looks much better. Now, no scar in here because we haven't touched that. All we did was a brow lift, okay, and the mid face lift. Another thing I don't like about the lower facelift is that when people pull back in here, it's okay, the skin's actually going to stick in here. Well, no, that doesn't happen. There's a play of forces between the skin you have pulled and the existing structures. So one thing you see in a lot of patients who've had a facelift is, the ear comes forward like this and appears to come long. And it's because you pull this skin, and sure, a lot of it will stay back, but there will be some relaxation and some pulling of the ear forward. Okay, so generally, I like to approach my facelift from top to bottom. And as a matter of fact, the last thing I will do with the least amount of pull is the lower half of the face. Now, the effect is dramatic. It's even seen on younger people who don't have like all the wrinkles and the fallen face or anything like that. For example, this patient, okay, she's already beginning to get a little bit of the jowling, but look, not a wrinkle in her face. I mean, nobody would say, oh, she needs a facelift. And the truth is, she doesn't. She just wanted to look better, okay? But look at the big volume gain in here, especially on a young patient, okay? And, overall, just a restructuring of the face. So on her, it's not so much that her face looks younger, it's that her face has been restructured to a better shape. And all of that with very modified, limited techniques. Now, I think that focusing from the eyes first and the mid-face first is a more rational approach. After all, it's the approach we use when we do facial fractures. We start from the top, from the solid base, and we work our way down. And that's the way I approach my things now. From a perception point of view, as far as how I look at the patient and how other people see the patient, but also from a functional and structural point of view. I want to get my solid anchoring face on the top first, so that by the time I get to the bottom, I don't have to pull as much. I don't get that pulled look. Anyways, if you have any questions, just write them on the blog post like you always do. I'm happy to hear from you guys. If you have any suggestions, please write them to me. Anyways, thanks for listening, and I'll be posting again soon.